Fundamental question 5. 1. A nurse is teaching a client with pulmonary disease about fundamental concept of gas exchange. With questioned further by the client, the nurse explained the earlier command and explained that gas exchange occurs through the process called 1. Diffusion, 2. Osmosis, 3. Active transport, 4. Ionization. The correct answer is 1. Diffusion. 2. Following initial assessment, the nurse determines the place need a best restraints on a client. The client tells the nurse that he does not want to best restraint applied. The best nursing action is 2. 1. Apply the restraints anyway. 2. Contact the physician. 3. Medicate the client with a sedative and then apply restraint. 4. Compromise with the client and use wrist restraints. The correct answer is contact the physician. 3. The nurse is preparing to administer tuberculin test to a client by the intradermal route. Which of the following action would the nurse perform when administering the test on the client? 1. Inject the medication and place a pressure dressing over the medication site. 2. Massage the area with an alcohol swab after injection to ensure that the medication has been absorbed. 3. Administer the injection with a needle while facing downward at 10 to 15 degree angle. 4. Make a circular mark around the injection site following the administration of the tuberculin test. The correct answer is 4. Make a circular mark around the injection site following the administration of the tuberculin test. 5. The nurse is caring for a client with a diagnosis of dehydration and the client is receiving fluid intravenously. Which of the following assessment data would indicate to the nurse that the dehydration is not resolved? 1. A urine specific gravity of 1.033. 2. A urine output that is pale yellow. 3. A blood pressure of 120 by 80 mmHg. 4. An oral temperature of 98.8 degree Fahrenheit. The correct answer is a urine specific gravity of 1.033. 6. A physician order reads acetaminophen liquid 450 mg per oral every 4 hours. PRN for pain. The medication label reads 160 mg 5 ml. The nurse prepare how many milliliter to the administer one dose. The correct answer is 14.1. 7. The clinic nurse has provided instruction to a female client diagnosed with pelvic inflammatory disease regarding home care measures. Which of the following statement, if made by the client, indicate an understanding for these measures? 1. I need to touch once in the morning and once in the evening. 2. I need to wear tampons instead in sanitary pad when I have my menstrual period. 3. I need to see physician to get intrauterine device for birth control. 4. I need to avoid tight fitting clothing. The correct answer is 4. I need to avoid tight fitting clothing. 8. A nurse has complete tracheostomy care for a client whose tracheostomy tube has non-disposable inner cannula. The nurse reinserts the inner cannula into the tracheostomy inflammatory after 1. Suctioning the client's airway. 2. Rinsing it with sterile water. 3. Tapping it against sterile surface to dry it. 4. Drying it thoroughly with sterile gauze. The correct answer is tapping it against sterile surface to dry it.